Welcome back, everybody. So every day we try, well, not every day, but during the weeks we try to talk to the MECs of the different provinces to see how they are coping with the coronavirus and the fight against the spread. Well, this time we look at Gauteng. And the Gauteng Health Department says it is trying to trace thousands of TB and HIV-positive patients who have not collected their medication since the start of the lockdown. More than 1,000 patients have failed to collect their TB medication, while about 11,000 have not collected their antiretroviral medicines. The department says patients' failure to adhere to treatment makes them vulnerable to other opportunistic infections, including the coronavirus. Meanwhile, Gauteng Premier David Makhura last week said certain townships in Gauteng are emerging as COVID-19 hotspots, even though numbers are still low. Among those are parts of Soweto, Orange Farm, Alexandra, KwaThema and Soshanguve. Gauteng Health MEC Dr. Bandile Masuku joins us via Skype this morning. It's great to have you, MEC. Thanks so much for being with us.
Good morning, and good morning to your viewers, and thanks for having us on your show.
You know, the numbers that I've just read out of those individuals that have TB and HIV and that are on medication that are not collecting it, this is a big story, but one would imagine that the patients are also concerned, because how are they supposed to collect medication if everyone is or was told to stay home and had to get a permit to get into a transportation of some kind?
Yes, it is a worrying problem, and it's a problem that we actually have been facing throughout the times because of the nature of Gauteng. We have a whole lot of patients who are lost to follow-up because of the mobility that we see amongst people living Gauteng to other provinces. And with the lockdown, it made it worse because other people didn't leave Gauteng for other provinces, which made it difficult for them to access the treatment.
So leaving provinces, but let's address the issue of perhaps messaging. Maybe there was incorrect messaging given to these patients that, you know, we were very strict in saying stay home, don't leave your homes, otherwise, you know, there will be trouble unless, of course, you are a worker that's going out there. Do you feel that we may have given the wrong messaging out and that scared a lot of people from going to hospitals to collect medication?
Yeah, I think it was a matter of the messaging. Because we also didn't really explain very much that other essential services are going to continue, particularly for those who are taking treatment for chronic medicines, and also the availability of community health care workers who normally helps us with compliance created that big gap and a challenge. So I do agree that the messaging was a big problem, but I basically think that maybe also the understanding was not there.
Yeah, possibly that could have been one of the reasons. I mean, we're talking at the numbers given, 11,000 that have not collected their antiretroviral medicines. And we know that if you do not take the medication, the repercussions are very far-reaching, and you know this just lowers your immune system to catch anything, and 1,000 for TB. How are you trying to trace them? What are the mechanisms in place now?
You know, we are using the experience now that we are having when dealing with COVID patients. So it has made it easy for us to be able to get some of them into getting their medication. And also with the community healthcare workers back into work and action. So it has also made it easier for us to be able to get hold of them. So we are also waiting for those who normally are coming back from other provinces that they should also make contact and also make contact. So we are using the technology that we are using for tracing COVID patients to find those patients of TB and ARVs.
Okay. Premier David Makhura also mentioned that some townships are emerging as new COVID-19 hotspots in Gauteng. Could this be one of the contributors as well?
Not necessarily. I think the issue is that when we started opening up a bit of the economy, you know, a lot of people work in the towns and in suburbs. and that also increase the risk of community transmission, where this pandemic will then shift into townships. And this is what we are following up now and making sure that we are looking at the contacts around those areas, and also increasing our screening, our presence in those areas, and also making sure that we are able to get those who are infected, who are not isolated, to be isolated and be able to deal with it in that way.
I mean, we saw, I remember if we go back right to the beginning of coronavirus, Gauteng was the epicenter. And since then, it's looking like, we've really managed to keep it under control. And the Western Cape is the area that's really struggling right now with numbers. However, and it's a big capital, however, we have got warnings that they may be reaching their peak, but we're still heading there. I'm going to talk to you about when we expect the peak to hit Gauteng. But, the numbers are controlled, but they can change at the blink of an eye due to these changing patterns. What are the patterns and the trends that you are seeing here in Gauteng?
It's similar to what we are seeing in Western Cape, because there is a source which usually is a factory. And in this case, it's particularly in the northern part of Ekurhuleni and Johannesburg. It is a source of a factory which had a whole lot of workers who were positive. So that is why we are concentrating more on making sure that the retail sector is actually compliant to the regulations and be able to for us to be able to screen and trace the employees in those areas, because it will make it easier for us to detect from that level. So that's why we are actually now looking at the compliances in the retail sector and even in the factory industry sector.
Yeah. I mean, we saw the numbers coming out yesterday. The latest figures in Gauteng stand at 2,400 confirmed cases, recoveries 1,694, and we've had 27 deaths in the province. So those are the numbers that are the latest figures right now. And obviously, we keep mentioning the different informal settlements and the townships that have been highlighted as possible hotspots and real areas to watch out for. But let's sort of talk to why. Why do some areas look like more hotspots than others? For instance, what makes townships like Tembisa, Soweto, Soshanguve and KwaThema more prone than others?
I think, the issue is about it's a condensation of a lot of things, but one of them is that we have got informal settlements with a whole lot of individuals who are now infected. And these are areas where self-isolation and self-quarantining, it becomes actually a problem. And also social distancing also is a big problem. So that is one of the major concerns that we're having, because those areas, if we do have an increased number of infected individuals, then we are going to have a problem in that area. But our new approach, and we have changed strategy, which started last week, of attacking retails. Now we are extending and escalating it into the townships and doing door-to-door, using community leaders and making sure that the community itself, they do enforce the regulations that are.
MEC, are you concerned about the whole of Gauteng moving to level 3 next month? We heard the Premier saying that it must not be an area-specific move. If the province moves as a whole to a new level. Are you happy with us? Are we prepared for that?
We need to continuously be looking at the hotspots, and making sure that we are continuously screening and testing individuals, and also the enforcement of regulations become important. But one thing that we need to realize is that our social sector must not be the one that is utilized for enforcing of the regulations. So we want to use the information sharing and mobilization of our community leaders, our faith-based organizations, to make sure that they, as a community, we take care of each other in terms of regulations, social distance, wearing of face cloth masks, and also making sure that we sanitize and hand hygiene is actually upheld. This is the only way that we can be able to have a proper lockdown in terms of level 3. We are still happy that the interprovincial traveling will still be regulated, and we're still happy that the international traveling will still be actually regulated in terms of the airports.
From the statistics and studies and projections that are out there, when are we expected to reach the peak here in Gauteng?
We are looking at the peak around August, September, but it also depends on what we put into place now in terms of the enforcement of regulations. Because if we don't do enough in terms of level 3, the peak might come a bit quicker. If we're not able to sort out the hotspots quicker, it means that the peak will be much quicker. But if we enforce the regulations and we work with the community, with the cooperation of the community, we are going to see the peak around September, which basically will make us more confident that our facilities will be much easier and be capable to handle the load of the patients.
I mean, some numbers have been doing the rounds saying that by November in South Africa, we could reach 1 million infections, we could reach 40,000 deaths. Do you have these kind of projections for the province, a breakdown into the different provinces?
We utilize the same modelers, and we have seen what they've put up as part of the possibilities, and that is one of the optimistic scenarios that they have. But we are also putting up a lot of enforcement issues and dealing with hotspots so that we can be able to lower that number. Because this number is not an absolute number. It's an estimation. It could be lower, it could be higher. And it all depends on what we put into place and how we work together, particularly with the sectors that can influence us in making sure that we are able to enforce the regulations. So what happens in future depends about how we handle the hotspots, how the retail sector and the industry sector play a role in making sure that screening and testing does continuously happen in their spaces, and that the issue of social distancing and other regulations are actually maintained and are enforced in their areas of their sectors and work.
MEC, are we ready for when this wave hits? Because it's not a matter of if, it is when, and we realize this. We've been warned for a very long time, and I can see you nodding with me. But already I'm seeing reports coming through in the Western Cape that ICU beds are full, that they already are struggling right now. What about Gauteng? Talk to us about hospital beds. Are we prepared there with the space for the patients that will be coming in? And also the issue of PPE, because I know that a lot of the nurses, the doctors, the medical professionals have been complaining that there is not enough. Talk to us about this.
Let me start with the PPE one, because we will never have enough. We might need to strive to have adequate levels of stock so that we can be able to make sure that our healthcare workers work with protection and without fear and without anxiety. And we are continuously procuring the PPE. We are continuously making sure that we innovate how also PPE can be utilized effectively and efficiently using the World Health Organization guidelines that will actually helps us through. But it is a function, and it's a matter that we cannot say at any rate that we have enough. We can only say that we are continuously procuring and making sure that our workers at any given time, they've got enough, what they have to be able to use. Yeah. In terms of the hospital beds, we do have currently 8,300 beds that are dedicated to COVID. And in those beds, we are having almost 2,000 beds, which are ICU beds, which are going to be high ICU and high care beds. But we're working towards making sure that by the end of July, we will be having at least 12,000 beds, which will be there for all our patients that will be requiring the help. And we are still looking at also creating other field hospitals other than Nasrec that we have had. Yesterday, BMW and Nissan, they gave us an undertaking that we are going to start a project around Pretoria North, Tshwane North, where we are also going to put another facility that will also help us to elevate the pressure around Soshanguve and Garankuwa.
Dr. Masuku, before I let you go, I just want to talk to a story that's been also doing the rounds, and also a comment from the health minister that came out last night. And this is with regard to what Professor Glenda Gray has been saying. I mean, Glenda Gray is the CEO of the South African Medical Research Council. She said quite a few things, but the one that relates here specifically to the province is that of Baragwanath Hospital. And she has claimed that there are now incidences of malnutrition that are coming into Baragwanath, things that we haven't seen in a very, very long time. However, the health minister came out with quite a scathing letter to her denying that this is the case at the hospitals. Can you perhaps give us more of an understanding of what is going on at Baragwanath? Have you heard of any cases of malnutrition in Baragwanath Hospital?
When we heard the comments, we knew that there's a big problem. Because having been in the province and working at Bara, I know that we have been having these cases of malnutrition. We're seeing them every day. And it was just something that was amiss, that she said that it has not been seen in the past decade. And we do respect Prof. Glenda, and we feel that she might have actually verified the information with us so that we provide the correct facts and the statistics around it. And maybe he was trying to make a point about how the services might have been affected by the lockdown. But I think he used a falsehood, and he used wrong figures, which are not actually true. Because we provided the minister with the facts and the truth that we see on the ground every day, that we do see cases of malnutrition. But even in this level of the lockdown, they have not increased as actually shared, suggested. So the facts and the truth is that there are cases which are worrying cases of malnutrition in Gauteng, but we also feel that, we are able to deal with them, and we have been dealing with them in the past decade. And so she used falsehood, and she used wrong figures, and I'm hoping that, she will concede, to that fact. And she was making a point for something else. Maybe she was just sidetracked by, the argument itself.
Yeah. MEC, the minister also came out and gave us figures of what the admission rate at Baragwanath is looking like. This was the statement last night, and the numbers that he gave us, perhaps you can confirm or talk to us as to what do you think the reasoning behind this is. At Baragwanath, he said that in April 2019, there were 2,885 patients, 500 admissions. As it stood here in 2020 in April, there were 834 patients and only 146 admissions. Are these figures accurate? I imagine you supplied him with this. And what do you believe is behind this drop?
I think that what is behind the drop is the effects of lockdown. Remember the first part of when our discussion, we spoke about ARV and TB, that the messaging and that came out after lockdown could have actually limited the actual people coming up and also even consulting in that regard. So I think the picture of low statistics is just an artifact of the lockdown. In essence, is that we are expecting quite a lot, because these malnutrition cases actually emanate from informal settlements, and that's where our problem is by and large. But these figures are low, and it's the effects of the lockdown.
Could it also be attributed to the lack of alcohol that's doing the rounds, perhaps the ban on the sale of alcohol? Do you think that this could also be one of the reasons?
I'm smiling because I just feel that some of the regulations that of the lockdown have helped us in a sense to help to decrease the burden of disease in our facilities and the number of cases. And alcohol is one of them, that we have seen that since its drop, the trauma cases have been quite low, and our trauma units have been less busy. And it's something that we have been saying, that the regulation of alcohol should continue, and we should have more stringent way of controlling the usage of of alcohol.
All right, MEC, we thank you so much for your time. Thanks for talking to us, giving us an update on how the status is in Gauteng with regard to the handling of coronavirus and other issues related to this. Again, thanks so much for that. We're very late on headlines, but this formed part of our headline bulletin, I know. But Sakina, perhaps you want to update us on some other stories and take us forward on this one as well.